Welcome to the Wellsprings Referral Spotlight Series. This is where we get to talk to some of our referring physicians and other practitioners and community members who help us care for our patients. And this is Dr. Safa Maklad. She is a board-certified family medicine physician. She specializes in wound care, hyperbaric medicine, and longevity-focused care, which is something that a lot of people are asking me about right now, and we get a lot of requests for referrals. She integrates traditional medicine with functional and regenerative therapies, and that includes things like hyperbaric oxygen, IV nutrition, microbiome optimization, all these things we hear about and we don't actually know what to do about them. Her work is centered on helping patients heal more efficiently, to optimize performance, and to prevent chronic disease. Dr. Maklad, thank you very much for being here.
Thank you for having me. It's great to be able to sit and talk with you.
Yeah, and outside of the office, sort of. Like
Yes.
we're not directly talking about patient care right now. We're actually going to talk about you personally. We want to get to know you a little bit better. Can you please highlight what you do for us? I know I gave a little bio, but tell me more about what you do and how you do it.
So I was obviously traditionally trained in family medicine, but then when I moved down here to Florida, I started doing more kind of functional medicine stuff. So integrating, other types of treatments in addition to like the regular stuff family medicine would usually do. So we have hyperbarics, IV therapies. We do a lot of testing, like as you said, like with the gut microbiome. And so it's just an interesting way of kind of combining traditional medicine with the functional medicine.
Made you want to get into that? Because that is, I mean, you're talking about combining, but for most
Mhm.
people, those are two very separate things.
Yes. So I used to work in a hospital setting. I was the medical director of a wound care center. So we had to listen to the rules pretty much. So anytime we did hyperbarics, it was only for FDA approved indications. But when I came down here, we were able to do off-label indications for HBO. And that included a lot of different things that I would have never done before. So that's how I kind of started in that path of going down the functional medicine part.
And what kind of patients do you see now, as opposed to your wound care patients in New York?
So concussions, long COVID, a lot of post-plastic surgery just to help them heal, and all those types of patients we wouldn't have been able to give treatments for.
Mm-hmm. And I mean, just personally, how do you like working in this way? Because it is a big difference.
But definitely a huge difference is because you're not so limited with time and resources. So I can sit down and talk to a patient for an hour and go through their history and everything compared to like this is the 10 minutes that you get and you have to move on.
I think that's part of the reason our patients love you is because you have the opportunity in the setting that you're in to be able to actually connect and ask questions, but you also have the expertise of, a very standard research-driven protocols, and you're
Yes.
able to do both. That's really nice.
So it's nice to combine the two.
So what do you think about South Florida versus New York?
It's so much nicer. It's warm. Apparently, I really like warm weather.
Tell me all the reasons. I agree with
Yeah. So yes, it's a change in pace and everything. So just different.
How did you get into wound care? So hyperbarics is your main area now, and the patients that you see are coming for that and other things as well that you're able to help them with. And you
Mhm.
mentioned that you started in New York doing much more standard care for wound care, but how did you get into that in the first place?
So that was just kind of a fluke. One of the medical director of the wound care center at the time, he was looking for another physician. I used to be first assistant for general surgeries, and he was the chief of surgery. So he knew me that way. And he's like, I think you'd like really fit into the wound care center. And I'm like, at first I'm like, I don't know if I really like wounds, but I'll give it a try. And it progressed from doing it one day a week to a couple of days a week and to finally taking over as medical director. So he decided to just be chief of surgery and no longer take care of the wound care center. And I became medical director. And so did that full time. Yeah. It turned out that I really liked it more than I thought.
Then you ended up taking that expertise down to here. It's amazing how the professional path can go.
Yes, yeah. It's so different from family practice. You get to integrate a lot more things.
And so, in addition to the hyperbarics, which is your original area of expertise, what other modalities do you use? Do you do hormone testing? I know you mentioned IV nutrition. What else?
Yeah, so we from all different types of testing. So like for DNA methylation testing, we do hormone testing, metabolomics, the GI testing for your microbiome. So it's yeah, the whole world is wide open when you don't have to deal with insurances.
What do you do with that information? How do you use that?
So we put it all together and try to come up with a plan for the patient to really optimize everything. It's very interesting what you can find on somebody's microbiome on all the different, bacteria that they're either missing or they have too much of. So it's just trying to fix those things and optimize.
And then how does that pair with whatever other medical care that the patient's seeing you are getting?
Yeah, so it's very like interesting. So like let's just pretend the patient's diabetic. It's so they're on their regular medications. So a lot of those medications, kind of like metformin, will actually deplete some of your vitamins. So if you're not testing for that, then you wouldn't know that they are depleted and to actually replace it. So normally those aren't things that, like if you go to your traditional primary, they wouldn't be checking for all your different micronutrients and everything. So yeah, so it's just kind of doing both.
So you can do both, is what I'm hearing. You don't have to pick you over somebody's.
No, 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 no.
If
This
you are
is
a family medicine doctor,
Mhm.
you can work generally in that way. But do
Yes.
most of your patients pair what you do with their other physicians or see you exclusively?
A lot of them, especially with the endocrinologist, they will see me in addition to their endocrinologist, and it's just like working together so that they're getting the best care they can.
And what other specialties do you work with?
Plastic surgery, obviously with the hyperbarics because they don't want their patients to heal well. And then with their primaries, a lot of patients will keep their primaries, but then see me also, and just to complement the care.
Okay. So based on your niche, because everyone we talk to has a different area of specialty and a different toolkit. So if someone is interested in the regenerative medicine and the longevity medicine, what is one thing that they could easily do at home or implement that you tell your patients that they might be interested in incorporating in their routine that you recommend to your people?
I recommend everybody to take a multivitamin. It's amazing how many nutrients we are deficient in, and just because of our food supply. And a lot of people don't eat the varied diet where they'd be getting all their micronutrients from their diet. So definitely a multivitamin and a probiotic.
Do you have a favorite brand, or you're not allowed to say that?
I don't know. I guess
Because
I
that's the
like
next question. Everyone's like, okay, well, what did you like? Which one?
I like pure encapsulations. I think, their multivitamin is very well rounded. It has, all the different micronutrients. Also has a good level of vitamin D, which a lot of multivitamins have usually low levels of.
So you wouldn't have to take an additional vitamin D with that.
Yes, unless you're super low, and then we might have to.
And how does someone work with you? What is your usual protocol for seeing someone, making recommendations, follow-ups?
So usually I have the initial appointment with them. It's usually an hour long so that we can go through the entire medical history and, see everything from pretty much the time you were born until this point in time. And yeah, and figure out what needs to be done. So then we come up with the plan of like what labs do we need to order, all that. And then we all that stuff is ordered and then a follow-up visit to see what could be done.
Okay, great. And if someone wanted to get in touch with you, how would they do that?
Okay, so I'm at O2 Pure.
I will put it in the notes for everybody.
Okay. Thank you.
Thank you very much for your time. I'll be seeing you soon.
Okay, see you soon.
Bye.